Hi, my name's Nicole, and this is a practical for CBT. Hi, Sarah. Thank you for coming to therapy today. How are you?
I'm alright, thanks.
That's good. Have you been to therapy before?
A couple of times when I was younger, yeah.
So, are you familiar with the way it's supposed to work?
Oh, little, could you give me a crash rundown?
Okay. So, I'll explain something. I'm a CBT therapist, so that is a cognitive behavioural therapist. So, I do a lot of focusing on the thoughts and the belief systems behind various behaviors. Okay? So everything that you tell me in therapy today is confidential. I won't be telling anybody. We're having about a 20-minute session just to get to know each other, identify some issues that you have concerns with,
Yep.
and we'll work together, and through that we'll be able to identify problems, identify your thought patterns and various belief systems with these issues that you're having, and then hopefully through the next few sessions we'll be able to implement some new alternative thought processes, and we'll be able to monitor them and see if they affect your behavior. Is that cool?
Yeah, no problem.
Okay. I'm not sure if I told you this, but just remember everything's confidential, so I'm not going to tell anybody.
Yeah.
Unless I feel like your life's in danger or somebody else's life's in danger. And of course, I will talk to you before breaking confidentiality, okay?
Yeah.
Okay, so are you okay with that?
Yeah, that sounds fine.
And comfortable moving forward with today's session?
Yeah.
Okay, cool. Ready. So what brought you here today?
Well, I'm just here because I have some issues and I think I should tell someone.
Okay. Have you told or voiced your issues or concerns to anybody else?
I've never really told anyone straight out, but I think people can see it in the way I do stuff and the way I eat and stuff.
Okay. So what are these concerns of yours?
I have body image issues, so sometimes I have to watch what I eat and I feel really bad, so I'll go for massive exercise periods and then won't be happy with how I look and feel like I should look like those people in magazines and yeah.
Mm-hmm. Why do you feel like you should look that way?
I guess because society tells me that and that I have to live up to those expectations kind of.
Mm-hmm. Yeah. So when did this start?
About 3 years ago when I really entered teenagehood.
Yeah. So when you became a teenager, these issues started to present.
Yeah.
Mm-hmm. Which part of this entire course of concern is the biggest problem for you?
Yeah. I think the biggest problem is what people think of me and say to me. Sometimes people are like, "Oh, you're obviously not eating right, or you're not doing things right. What's wrong with you?" And it's just hard because I'm not sure what people think of me, and yeah.
Okay. And what triggers that?
I guess when I have one of my kind of outbreaks and when I'm just really not in happy moods for a few days and I just get really in the zone of looking good and yeah, people just really see it then.
And what does it look like when you're in the zone, as you say?
I don't eat right, and if I do eat, then I just eat vegetables and fruits, and I don't let myself have anything, but I'd one sweet a day, otherwise I feel like I'm going over, and then I go for massive exercise periods, as I mentioned, and just get really worn out and tired. Yeah.
Okay, so in this cycle, so correct me if I'm wrong, you enter the cycle of needing to look good, so you eat healthy, stick to a bunch of rules, go for a massive exercise period, and then exhaust yourself and fall asleep. Is that accurate?
Yeah.
Does that last one day, or is that like an hour or a week? How long?
I think usually it's about a week long, and it happens every couple of months.
Okay. Yeah. So what do you think when you're in this zone?
I just kind of think that I need to be accepted, and I need to live up to the expectations of society these days, and how everyone wants, everyone kind of wants to look good, but I don't know, I just feel like I should live up to the people in the magazine.
And before, okay, so you mentioned that you have about a week where this lasts, and then you can go 4 to 6 weeks where society would class it as normal. Is that correct? What happened prior to the start of this week-long behaviour?
I guess sometimes I just throw the rules out the window that I make for myself and go all out and to be polite when I'm over at people's houses, just eat what they give me and when they give me, and just go with my friends so I don't have time to do anything else. And then I realize like what I've been doing, and then I threw the rules out the window, and I just kind of get back to the zone.
Yeah. So within 3 days before the week happens, are there any common thoughts or behaviours that occur?
Well, a lot of the time I think, no, I'm normal. I really shouldn't do this again. But then I don't know. I just think I want to be better, and I want to get better looking, I guess.
Okay, and what is better looking to you?
I don't know, slim but curvy, as people say. Like all the fancy new hair and makeup and all that sort of stuff. Yeah.
Okay. So throughout this week, where the behaviour does occur, and your thoughts are, as you said, all about needing to be better, what are the consequences of that? How do you feel, what do you think after the behaviour occurs?
After it happens, I think I feel better about myself because I usually feel kind of healthier and more fit and stuff. But then I step back and look from a different perspective and see that it's wrong. I should just live my life how I want to live it, not wanting to look like someone else or anything.
Yeah.
But yeah.
Okay, so how do you feel?
I feel like, yay, I'm doing good, but then I also feel bad because this is all going downhill. This is a problem for me. I need to get this sorted out, and so I kind of have mixed emotions about it all, and I'm thinking to myself, well, I feel better, but do I really look better, and is this really something that I need to keep doing? Yeah.
And what's usually the answer to that when you ask yourself that question?
Sometimes I have different answers all the time, but sometimes it's like, yeah, okay, I have to stop doing this. I'm just gonna live my life how I want to live it.
Yep.
And that's okay. But a lot of the time, I just think, well, if this makes me feel better about myself, and if this makes me think I look better, then why should I stop?
Okay. So I've noticed a few beliefs associated with these behaviours and thought patterns. Correct me if I'm wrong again, but it sounds to me that you believe that you're not pretty enough. Is that, yeah?
Yeah, I think that's a lot to do with it, yeah.
Okay. How do you feel about that belief? Are you okay with that? Do you feel like it's inaccurate, or?
I feel like I should be content with myself and believe that I'm pretty enough and good enough. But then I'm also really content with the belief because, I mean, everyone's their own person, but sometimes you just have to work harder to be what you want to be, I guess.
Yeah. Okay. So, while being okay or wanting to be okay with yourself, you're also not sitting with being okay with yourself. Is that right?
Yeah. Yeah, I think.
Yeah.
Yeah.
Sorry, I'm really trying to understand where you're coming
Yeah,
from.
no, I understand.
Yeah. It's a bit. Yeah.
Yeah.
How do you feel about that?
Well, I don't know. I just feel like I don't know. I just feel like I need to come see one of you guys so that I can help sort out my feelings.
Yeah.
Yeah, and like see what I need to do and see if I should do anything and all that sort of stuff.
Well, do you want to do something?
Yeah.
Yeah.
Yeah, I feel like I need to fix this and either just get into a healthy routine or like just do whatever I want, but I guess there is consequences with that too.
Yeah. There are. There's consequences with every action and thought
Yeah.
and behaviour.
And
There are
just about
always
everything.
consequences.
Yeah.
Yeah. Okay, well, on the health side and the physical and well-being, I can help you with up here and in here. However, on a nutritional level and physical level, it might be worthwhile to see other professionals in that area. Perhaps I can give you some numbers to a nutritionist and personal trainer, and they'll be able to teach you ways to eat healthy and exercise in a healthy manner so that you're not overdoing it in any which way.
Yeah.
But for today, we can discuss how we can work on the thought processes behind the drive to do this behavior.
Yeah.
Yeah? Okay. So we've established that the behavior lasts for a week. Approximately a week.
Yeah.
So tell me again, what do you think is the key thought or thoughts that trigger the process of this behavior?
I think it's just that I don't feel right anymore, and I feel like either I'm getting fatter or people are noticing when I don't wear makeup and thinking that I look worse, and that kind of really triggers it for me.
So would you use the word paranoid or concerned about what other people think? Or
well, I'm definitely concerned about what others think, but then again, I think I'm only really paranoid when I go in just before I go into that cycle, or like as I'm in there, and I just want people to notice me that I'm actually okay.
Yeah. Okay. So, what are some things that you could possibly do to help you feel okay in that moment? Like before we get to the moment where it's all gone and the behavior has already started. So in the few days beforehand where you start feeling concerned about other people's thoughts and that, what are some things that you feel like you could do to help prevent the next relapse?
Well, sometimes I feel like I should just ignore it and like just move on with my life, not caring. But then, how can you ever stop caring once you do, right? And I think that if I just ate healthy constantly, yet nutritionally good as well, then I think that I could feel better about myself. And if I like put in a good regular exercise regime, like not overdoing it or not underdoing it, then I think that would be better for me, but I don't know how to do it.
Okay, well, that's why I'll give you some numbers of some healthcare professionals that I work closely with. A lot of my clients I refer them to. But for now, like how much time do we have left? Um, sorry, in about five minutes.
Yeah.
In about 5 minutes, I'll be able to give you some of their business cards. And if you want, we can call them together, or you can call them however you want to do it. I'll support that. But let's work on the thoughts again. Sorry.
That's okay. Yeah. Yeah.
Okay. So we've established that you think that society doesn't accept you, or you think that you're getting fat.
Yeah.
Okay. And the consequence of those thoughts is the commence and duration of the behavior.
Yeah.
Yes? So what do you think would be an irrational belief?
An irrational belief.
Yeah, like, let me explain that a little better. An irrational belief, to you it may not seem irrational because it's perfectly acceptable to feel and think such ways. However, it may be harmful. So I did identify one that may present, so please correct me if I'm wrong again, or totally off. The belief that prior to this commencement of the behavior that you are getting fat. That's a thought process, and that's something that you're constantly telling yourself, which is an irrational belief. Okay? Would you agree with that? Do you feel like you're actually getting fat, or is that something that you keep telling yourself?
I think like sometimes I feel it and like it's coming on or whatever, but then other times I know it's just like in my head, but I can't seem to
Stop it?
yeah, stop it and rethink it and
Okay. Okay. So we've identified at least one irrational belief. So let's work on that for today. For the next 5 minutes again, let's work on that. And maybe we'll be able to find, or at least brainstorm a few ideas to be able to counteract that belief and thought process. Next week, if we don't have enough time, we might be able to create a new thought process or a mantra that you can keep saying to yourself to hopefully overpower the belief. Yeah?
yeah.
Okay. So if we're starting with the belief that you feel like you're getting too fat, how often do you tell yourself that?
Every week or so, and sometimes I just push it out of the way and I'm like, no, it's okay, but then other times I just take it on board and I'm like, wow, I need to sit up.
Okay, in those moments, is it just once that it passes through and you just sweep it away and you're like, yeah, I really got to do something about that? Or does it kind of sit in your head and go over and over and over?
Yeah, it kind of just like itches in the back of my mind until
so it's like a nagging parent to help you clean your room
for a day or two.
Yeah. Yeah. And in the times that you are able to push it away, what do you do?
Sometimes I just like go for a run or usually when I do even just a little bit of exercise, it goes away, at least for a while. And then I can sort of start the cycle all over again.
Yeah.
Yeah, but that's...
Okay. So in the thought process and the irrational belief, there is an idea that I have that has worked with some of my clients, and I use it every day. It may not work for you, but it may be worth a try, at least to start with. Is that okay?
Yeah.
It's called a mantra. It's something that is short, heavy, a sentence possibly two, that when you find yourself in a difficult place, you tell it to yourself, and you tell it to yourself over and over and over again, until you've told it to yourself enough times that you believe that that is what's real. Okay? Yeah? Okay. So what are some key words that you would believe? Like, what's some of the stuff that you would believe if you told yourself?
Well, if I told myself stuff like I look great or whatever, then I wouldn't believe it.
No.
But I think more words like that are toned down a bit, like I'm fine, or
So like a smooth, mellow.
like this is okay, I'm alright.
Okay. Yep. All right. How do you feel? Is it a society-driven belief or is it a self-driven belief?
I think it's kind of both. I think it's a self-driven belief, but society kind of triggered it.
Mhm.
Yeah.
So, tell me something that you can say to yourself, something just short that you would believe in your own words to put this at ease.
I think maybe.
Take your time, it's alright.
Yeah. Maybe I'm doing okay. I look fine. This is all gonna be okay. Something like that.
Okay? So, I'm doing okay, I look fine, everything's gonna be okay. Okay? So, that's good, that's really good. That's 3 short, to the point, perfect examples. How would you feel about telling yourself that maybe 10 times in the morning, 10 at lunch, 10 at dinner, and then non-stop when these other thoughts start coming in?
I think I could do it. Yeah.
Yeah?
Yeah.
Okay. So let's just have a practice. Tell me one more time.
I look fine. I'm doing okay. Everything is gonna be great. Okay, fine. I lost it.
No, that's okay. You got the essence.
Yeah.
So I look okay. I'm doing fine. Everything's gonna be okay.
There we go.
Yeah.
Yeah.
Okay.
Again?
Again. Let's go. Come on.
I look okay. I'm doing fine. Everything's gonna be okay.
One more time.
I look okay. I'm doing fine. Everything's gonna be okay.
Okay. One more time. Make me believe it from your soul.
I look fine. I'm doing okay. Everything's gonna be fine. I mixed them up again,
Yeah.
but
I look okay. I'm doing fine. Everything's gonna be okay. I look okay. I'm doing fine. Everything's gonna be okay. So now can we let's close our eyes. Take a deep breath in. Hold it. And let it out through your mouth. And I'll repeat with me. I look okay. I'm doing fine. Everything's gonna be okay. And open your eyes. Alright, do you think that you'll be able to tell yourself that every morning, noon, and night for the next week until I see you again?
yeah.
And if you feel like this triggers of behavior is coming on, take this mantra that you tell yourself 3 times a day, morning, noon, and night, and just don't stop. Just an endless cycle. Just keep going over and over and over, and eventually it will become your belief. Okay?
Thank you. Yeah.
No problem. Alright, let me just get those cards for you.
Yeah.
And I'll be able to refer you on to other professionals as well. Cool, listen, it was good to meet you. I'll see you next week.
Yeah. Yeah. You too.
Okay, bye.
Bye.